intimate cobra. So, oh, okay. This one's different. So we're going to go ahead and get in between the thighs. So we're going to walk in, lift up at the knees right here, and just stick your thighs underneath, right there, so you're kneeling on it. Okay, Roman handshake, my hands. And you're just going to lean back and lift them up. So that's intimate. I mean, what's the purpose of it? Not a whole lot, but it's just fun for your patients. Do it every once in a while, mix things up.
I think you're really doing something.
Well, it's a good full body extension. You know, you get the upper body going into extension, the lower body going into extension. You can see the nice bow kind of thing. So they're pretty much focused on the center, and you can just sort of move them around. So you be the Pilates person for them. Then cross scissor stretch. We're going to stand up, grab one foot and wrist. We're going to raise the limbs up. So I'm going to grab this one here, Roman handshake one here. Do a nice lift. If you want, you can put just a tiny bit of pressure and pull a little bit there. I'm going to walk to the front. Tiny bit of pressure and pull a little bit here. So just lifting them up. How's that feel, Ivan?
That's good.
You can do a little bit of movement. Oh, he just adjusted you here. He corrected. Where was it, lower back?
Like right here.
Yeah, that was nice. So that's the cross scissor. Now lateral scissor, we're going to be both on the same side. So same thing. So we're just going to come up in here. And again, you can put this foot low back, just give them a little bit of a pull. Move to this side, a little bit of a pull. And lift them up. Do like a nice rocking motion if you want. If I want, I could walk to the other side. Just be careful. Put your foot in here if you want. And just sort of lean them up against the back of your leg, the calf. You okay? Yeah, this is really nice. Okay, so that's the lateral. So cross just means opposite leg to the arm. Laterals, both sides. Then it says palm press to back. So we're going to stand and put hand over hand. So put left hand over left scapula, right hand over right SI joint. So we're going to lean forward and press. Do diagonal. So you go like this. This kind of works. So you're going to be stretching them out this way. So right on the SI joint right here, it's really nice, opens it up. You okay? So same on the other side. Just want to get near the SI right here, so here's PSIS. Get the palm right in the SI joint right in here. On this side you can just lean forward. Ooh, correct it again.
So this is good for the sacroiliac dysfunction?
Mm-hmm. Yeah, sacroiliac joint. That's where most back pain comes from, is that joint right there. So it's good to keep that mobile. Remember, our whole job as massage therapists is to put motion in the joints. That's our job. You know, we want to reestablish motion in a joint. That's where pain comes from, when the joint can't move properly, and the whole surrounding muscles that support it end up having to, you know, they're overused because they're trying to figure out what's going on in that joint. And so, you know, they're trying to adjust that joint. And the joint just can't move. Do you help it to move? So then it says thumb fist aligns to the back. So we can thumb fist. Right on his longissimus is a good spot. And then we can go ahead and palm press. You can do this kind of torquing kind of palm presses, which are really nice. Feel good? So one way. Check the back out and see which side is higher. So if this side is higher, I might want to torque a little bit to the inferior, and this side's a little bit lower. I might have torqued this to the superior, like that. That's good. Okay, and then our next page, torso lift. So it says roll client into supine position, and then raise legs against the lower abdomen. So we're gonna go ahead and put him in supine. So Ivan, why don't you put your hand across your chest? Yeah, so we grab this hand right here, and we're gonna go under his leg that's closest to us, and then over the other one. So I'm gonna go under and over, and just grab right here, and I just pull. So that's a nice flip.
How difficult, like, if
So now
we
we're
did
gonna
that
do
to
torso
any of our
lift.
patients,
So once we
they
do that,
just-
we're gonna walk up, Roman handshake. What we're gonna do is just go ahead and lift them up, just to get them a nice stretch. It's good for a low back. Then we're slowly lower him down, and then we cross his legs into the like a yoga kind of position. We do the same thing. We can do a little bit of movement, swing him a little bit. And then you just slowly back up, very slowly. He's going to come up to a seated position, like that. You just leave him there for a second. And then we got the T-twist, so could you spin your legs around for me? So next what we're going to do is go ahead and put your hands behind your head. Go ahead. We're going to grab the right hand on the upper chest. That means I'm going to put my inside of my thigh right in here, so it's not bony, on top of his left thigh. So right hand on the right side. Then we're going to turn him in place. You got to get this twist really strong before you lower him. Then I'm going to lower him at an angle this way. So not straight back. So watch, I'm going to twist him, lower him at an angle, and then bring him back. It's a good stretch for the body. A lot of times you'll hear some corrections taking place. Don't take credit for them. It's a chiropractor's job. He's going click, click, click all the way. Okay, so that's the T-twist. Now I'm going to ask him to move his legs around to the opposite side of the thing. I want you to go ahead and put your hands behind your back. Nope, this way. Hold my hand. What I'm going to do is just take my feet, just walk up his spine. Great for people that work in the office, rounded shoulders. Okay? So you just gently walk the spine. So I might put my toes right there. So now I'm pulling them back over my toes. A little bit, go inch by inch. Now I've got the inferior border of the scapula. My toes are holding it. So medial border up towards the top. You can get a little bit of work. You okay? Feels good. Again, we're establishing motion in the spine now. So basically, that's it. Gratitude. So at the end, you thank the person. Steven Seagal style. He's done. And you have Thai massage pro.